Good afternoon, everyone. You are all welcome back to another semester. I still remain Nurse Abubakar Muhammad. In this particular semester, I'm going to be taking you through pharmacology. Well, pharmacology is one of the most important courses as far as nursing profession is concerned. Reason is because you deal with series of drug, how these drugs are administered in your areas of practice. And therefore, it's very, very important for you to know about these particular drugs. And that is the reason why you study pharmacology. There are a lot for us to discuss under pharmacology, but for you to understand pharmacology better, you need to understand the introductory aspect of it. And I believe that you already have a preliminary knowledge about pharmacology right from your basic programs. Notwithstanding, we are going to recap or refresh our memories about what we discuss in our basic programs, which is under pharmacology. Now, let's start from the word pharmacology itself. Pharmacology itself is gotten from two Greek languages, meaning it's a meaning of something, which is the pharmaco and the logy. Pharmaco in Greek language, let's start from that. Pharmaco in Greek language means three things, which are the medicine, the drug, and the poison. That is what pharmaco stands for. Then the logy after it means the study. Now, when you look at this word, it's now telling you that pharmacology is the study of medicine, drug, and poison. And why must it be that way? It's because medicine, we all know the purpose it serves in human body. Drug, we all know the purpose drugs serve in human body. And likewise, the poison, the effect of poison to human body. Out of these three things, drug is centralized, meaning drug remains in the center. The drug itself can be a medicine, and the drug itself can also be a poison. Whenever you take drug in right manner or rightful manner, is going to produce a therapeutic effect. That is a desired effect you want. Then whenever you take it, the same drug, whenever you take it in a lawful manner, is going to produce another effect, which is unwanted effect, and we call this a side effect or adverse effect. And that is why here pharmaco stands for these three meanings: the medicine, the drug, and the poison. The logy is the study of these three things. But we also define pharmacology in other ways. We have numerous ways of defining pharmacology, such as pharmacology can be defined as a branch of science that deals with the study of drug and their effects to the body system. Pharmacology can be defined in different dimensions. Now, let's look at a brief history of pharmacology itself. Pharmacology is said to be as old as that of mankind. meaning it has been existence since the existence of human being. But the way pharmacology was then is different from this modern pharmacology we are living in now. It begins from primitive era. At that moment, whenever an individual is sick, instead of them to give that sick person, a drug to take, they rather give the person a noxious substance gotten from a dirty water, a dirty sand, and a dirty clay, meaning clay, a clay swell, a type of clay swell. You know, when it's rainy season, the way it looks like, they bring these things together and compound these things together. And as soon as they compound it, it became a noxious substance, and they give it to a sick person. And as soon as the person takes in this noxious substance, the person gets well. Reason is because anything that has to do with medicine has to do with belief. We call it belief system. Whenever you believe this particular drug is going to work for you, it's actually going to work for you. And whenever you believe it's not going to work for you, it's not going to work for you. And that is what they believe on. They believe on these noxious substances. As soon as they consume it, it works for them, and they continue taking it, and fine, it works for them. It continues that way. That is the remedy that was used in treatment of most of physiological illness or diseases. Then the ones that was used in treatment of mental illness, unlike now that we have drugs used in treatment of mental disorders, such as antipsychotic drug and sedatives. Then it was not that way. What they used to treat mental conditions then was, if whenever somebody is having a mental issue, they chain this person, lock him in a room, and beat the goodness and mercies out of this person's body. Reason is because they believe that this mental condition is not caused by any physiological process, rather it's caused by the presence of irreversible evil spirits. And the same thing as that of physiological conditions, they give noxious substance. They believe these conditions are not caused by microorganisms, because they believe microorganisms doesn't exist. They believe all are from irreversible evil spirit, and that's why they give these things or these remedies. And since they believe on these remedies, it works. Not until 1500 BC, that is before Christ. That is 1500 years back before Christ, they now start to discover medicines from root of plants. What we just call herbal medicines now. They start to discover them from root of plant. Initially, quinine was discovered using treatment of malaria. Quinine was discovered from a bark of plant called chinchino bark. It's just a root and bark of plant. We call it chinchino bark. This is where quinine was gotten from. And they start giving it to people, and it serves as a remedy for treatment of malaria then. Castor oil was also discovered at that moment. Castor oil was used as laxatives. The work of laxative is a stool softenant, meaning it softens the stool of an individual to prevent conditions like constipation. So castor oil was used as laxative that time to treat series of diseases, not even for that of constipation and others. It's majority of these herbs that was discovered from root of plant are used in treatment of several diseases, and that is what gave birth to herbal medicines that you see now. People selling herbal medicine, they will tell you this one is used in treatment of this one is used in treatment of this one is used in treatment of this. You can see it with multiple effects. Then at the same time, at that time, squill was also discovered. Squill was discovered as a, 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 a medicine used in treatment of intestinal worms. They use it to treat worms infestations. A lot of medicines were discovered. Then after that, we also have in 1869, the first synthetic drug was chloral hydrate. And this chloral hydrate was invented and be used as sedatives. Chloral hydrate. That was the first chemical drug that was first discovered. That is in 1869. That is when they discard the issue of herbal drugs and other, then they start to produce chemical modified drugs. Chloral hydrate was discovered then. It was used as sedative. That is in the year 1869. Then in the year 1893, the first synthetic anesthetic drug called thiopental was introduced. Thiopental is the first synthetic anesthetic drug. And we all know the work of anesthetic agents. They are used to block pain. So the first synthetic anesthetic drug was thiopental, the one that we now use as pentazocine. Was the first synthetic anesthetic agent that was discovered. That is in the year 1893, by a scientist called Dr. Ernest H. Then after that, in 1920, that is 19th century now, a drug was discovered which is the insulin used in treatment of diabetic mellitus. The drug was discovered by two scientists, which is Dr. Frederick Banting and Dr. Charles H. These are the two scientists that discovered insulin back then used in treatment of diabetes mellitus. That is in the year 1920 in University of Toronto, Canada. That was where the scientists were. They carried out a series of research to discover insulin. So definitely insulin was discovered in the year 1920 in the University of Toronto, Canada, by Dr. Frederick Banting and Dr. Charles H. Then from there, a lot of chemical modified drugs were produced. A lot of drugs were discovered and being produced and put into circulation. And up to date, we have a lot of drugs we take used in different sects of diseases. There are drugs we take used in treatment of heart diseases. There are drugs we take used in treatment of digestive system disorders. There are drugs we use in treatment of endocrine system disorders. There are drugs we take used in treatment of nervous system disorders. There are drugs we take used in treatment of spatial senses disorders. And that is why you study this method. Whenever you study methods to know the abnormalities that affect these body structures, then you study pharmacology to know how these conditions are going to be managed. That is just a brief history of pharmacology. Then let's go to the importance of pharmacology to nursing profession. Like earlier I've mentioned that pharmacology is very, very important because you need it to practice as a nurse too. Because you administer drug to a patient while you are on duty. Then my question now is, do you know the type of drug you are administering to a particular patient? What do I mean by knowing the type of drug? Do you know the mode of action for this drug? Do you know the possible side effects for this drug? Do you know the therapeutic effect for this drug? Do you know the contraindications of this drug you are administering? As a nurse, you need to know that. Majority of death cases that are recorded in hospitals these days are due to negligence of health workers. Some people administer drug, they don't know any information about this drug. But as soon as the physician prescribed and give order to be given to a patient, you as a nurse, it's your responsibility, primary responsibility, to know about this drug that's been prescribed by the physicians. Whenever you fail to, or you don't know anything about this drug and you continue to administer this drug, at the end of the day, the law will catch you, or will catch up to you, because it's your primary responsibility to know the information about this drug, but you don't know. At the end of the day, you end up terminating the patient's life. Then if it is a place where there's a legal practice, then you will be called to answer questions. Not like other parts of medicine, especially in this country, other part of this country that you work, where it's, everything we do is lawless. You work during the course of caring for a patient, it may be as a result of negligence or lack of knowledge of particular treatment to give to a patient, it costs the life of a patient. And at a part of it, I say there is a time. You say the kwanaya carry, whereas you are the one that has seen the death. But you don't know where you're going to practice tomorrow. You may practice in a developed countries where there is a strict law. Whatever you are administering to a patient, you are going to be accountable for that. And that is why you need to have the knowledge of pharmacology. So pharmacology helps the nurse to know the effect of drug they are administering to a patient. Pharmacology also helps the nurse to know the side effects of a particular drug they are administering to a patient. A situation where you administer drug and patient is reacting, an unusual reaction, you should have known that yes, this is a side, this patient is reacting to this particular drug. So that it won't be a situation where after administering drug, the patient will be panicking and you'll be panicking too. Both of you will be panicking. We don't know who is the patient, we don't know who is significant, we don't know who is the nurse. So you need to know the side effects of a particular drug. That's one of the importance of pharmacology. Pharmacology has numerous importance. Now let's look at the branches of pharmacology. The branches of pharmacology. Pharmacology is basically divided into two branches, where we have the pharmacodynamic and pharmacokinetic. Pharmacodynamic and pharmacokinetic. Now let's talk about pharmacodynamic. Pharmacodynamic is the study of what the drug does to the body, meaning the action of drug towards the body. Whenever you take in drug, how does this drug work on your body is called pharmacodynamic. Whenever you take drug is chemical substance. Whenever you take in drug, it goes into your body. Before it works on your body system, it must rest in a particular place. And the name of that place it rests on is called the receptor. In our body, we have two types of receptors. We have intracellular receptor, that is receptors found inside the cell. Then we have membrane-bound receptors. These are receptors that are attached to the cell membrane. So whenever you take this drug, every drug you see today, they have a designated receptor. They have a specific receptor they bind on. Therefore, as soon as you consume them, they absorb into the body through the bloodstream. They don't go direct to act on the body system. Rather, they must bind on their receptor first. They must rest on this receptor before they are able to take action. Then, in the receptor, it's made up of properties. Receptor is not just designed for a particular drug. No, it has properties. We have properties of affinity and property of selectivity. What do we mean by affinity? Affinity means a tight binding of a drug to a receptor. A situation where drug is administered and it binds tightly to a receptor, that process is called affinity. This is one of the properties of receptor. We have another property called selectivity. What do we mean by selectivity? Selectivity means a situation in which a receptor is selecting a particular drug. As soon as drug is administered, it goes into the body. If that receptor is not meant for that drug, it will not bind with that particular receptor. The drug will remain useless in circulation, and that is a major reason why sometimes you take drug. You feel that this drug is going to work for you, but it won't work. Why? It's because the body physiological process may affect the pharmacodynamic of that drug. You don't expect PCM, paracetamol, to go and bind on the receptor of flagyl. As soon as PCM goes to bind on the receptor of flagyl, there is going to be what we call selectivity. There's not going to be affinity. There's not going to be tight binding because that is not a designated receptor for it. And these are the properties of receptor. And that is what we call pharmacodynamic. This is a study of how the drug works on the body or acts on the body. And which I said, for drug to act on the body, there must be receptor where it will rest on after consuming this drug. Then these receptors have two properties. Properties of affinity, that is tight binding of this drug to that receptor. Then we have properties of selectivity. That is a situation where receptors select particular drug. In fact, there are sometimes that a drug will be administered or given or be consumed to bind with a specific or a designated receptor, but at the same time, this receptor will not be recognizing this drug. That may be as a factor that affects drug effects, because we have external factors that affect drug effects. So this is what we call pharmacodynamic as one of the branch of pharmacology. Then the second branch is pharmacokinetic. Pharmacokinetic is a study of how the body responds to drug. Meaning a situation where you are going to take in drug, how will body respond to this drug you are taking is what we call pharmacokinetic. It's one of the branches of pharmacology. Now, let me explain the process of pharmacokinetic. Pharmacokinetic begins from absorption. As soon as you consume drug, in respect of whatever route you consume this drug, either through IM, through IV, through oral, through rectal, through sublingual, through whatever means drug is administered, all and all is going to absorb. Then the first point of pharmacokinetic is absorption, meaning the process in which this drug is going to enter into the bloodstream. And as soon as this drug enters into the bloodstream, the next thing under pharmacokinetic is going to be distribution, which is a situation where this drug is going to move to several parts of the body where the drug is going to work or act on, or where its own receptors are located. After it's absorbed, the next step of pharmacokinetic is distribution. That is a situation where the blood is going to transport this drug to where it's going to bind on, or the receptors where they are going to bind on before they act on the body. After distribution, the next point under pharmacokinetic is biotransformation or detoxification. This is a situation that involves the liver, a process where liver break down these drugs into simpler units. Remember, you are taking this drug in high chemical form. As soon as it gets to the liver, liver is going to break down this drug into simpler units. That is why we call it biotransformation. There are enzymes in the liver that break down this drug. They break down the chain of these chemicals into simpler chains. And that is why enzymes are known as catalysts. They are known as catalysts because they break down chemicals. By the time the liver is able to break it down, in the biotransformation or detoxification is of two parts. We have the active part and we have the passive part. The active part is a situation where after the drug has been detoxified or been broken down, it will now be utilized by the body tissues. That is, it will now be used to provide a therapeutic effect. That is a desired effect you want. Then the passive form now is a situation where the liver removes the unwanted substances of this drug. The waste of this drug, the liver will remove it and transport it to every part of body that serves as point of exit for this drug, such as the kidney. And that is why whenever I look at it, kidney is one of the organs that helps in elimination of even drugs, such as skin is an excretory organ. Kidney is an excretory organ too, where these drugs are being eliminated out of the body, meaning the unwanted part of the drug are being eliminated. That is what the passive part is. Then the last part is elimination. The elimination is part of what we just discussed now, a situation where the unwanted part of the drug will leave the body, either through the skin or through the liver, kidney. So that is that about pharmacokinetic. Remember, I said the process of pharmacokinetic itself is a situation or a study of how body responds to drug you take. And it's made up of processes starting from absorption, distribution, biotransformation or detoxification, and finally we have elimination, which I've earlier explained. That is the basic branches of pharmacology. There are a lot of terminologies that we need to look at under pharmacology. We call them the terms used in pharmacology. These terms are very, very important for you to know as a foundation to build up your knowledge on pharmacology. We have terminologies such as pharmacodynamic, we've discussed it earlier. That is a study of how drug act on the body. Then we have pharmacokinetic, that is a situation or a study of how body responds to drug. Then we have ligand. Ligand is any substance which could be either drug or chemicals that binds to a receptor or that have ability to bind to a receptor is called ligand. Anything that has ability to bind to a receptor, it could be either drug or hormone or any chemical that bind to the receptor, they are called ligands. Then we have receptors. Receptor itself is a protein designed in the body that serve as binding sites for substances such as drug, hormone, and whatever chemical that binds to a receptor. Then we have therapeutic effects. Therapeutic effect means a desired effect that is expected after drug administration. After drug has been administered, the desired effect, the effect you are expecting, is called a therapeutic effect. Then we have side effects, or you call it adverse effects. Adverse effects, they are effects, unintended or unwanted effects that occurs after drug administration. Is an unintended or unwanted effect that occurs after drug administration. We call it adverse effect or side effect. Then we have contraindications. Contraindication is the reason that stops one from taking a particular drug. Like for instance, whenever you want to administer non-steroidal anti-inflammatory drugs such as ibuprofen, diclofenac to a patient, you barely ask the patient first, do you have ulcer? If the patient says yes, it means that this patient is contraindicated to this drug. Why? It's because he's having a condition that will stop him from taking this drug, which is peptic ulcer. That is contraindication. Then we have dosage. Dosage is the amount and frequency of a drug. It is the amount and frequency, or frequency is the amount or frequency of a drug. We call it dosage. We have posology. Posology is the study of drug dosage. Posology is the study of drug dosage. Then we have half-life. Half-life is the time it takes for the amount of drug, active substance in your body to reduce by half, or is the time taken by the concentration of drug into half. Meaning, whenever you take in drug, at times you take drug in divided doses. How the drug work, the effect of that drug from the time you take it to the half of the time that you are expecting this drug is going to start working on your body system is called half-life. Then we have indications. Indications are signs, symptoms, or medical conditions that led to the recommendation of treatment, tests, or procedures. They are signs, symptoms, or conditions that led to recommendation of treatment of a test or procedures. That is the indication. There are a lot of terminologies, but these are few among the terminologies we have. Therefore, we are going to end our class for the day. Whenever we meet in our next class, we are going to discuss more about this. That is how we will continue to discuss it until we arrive at where we are going to. Thank you very much